AMCA mock test 81 questions with explained answers. Question 1. Verbal facial expressions or body language, such as a nod of understanding, are called Option A, external noise. Option B, internal noise. Option C, channels. Option D, feedback. The correct answer is Option D, feedback. Explanation. Feedback is the receiver's response that shows whether a message was understood, and it can be verbal or nonverbal, such as a nod. Question 2. Issues relating to medical advances come under the heading of Option A, malfeasance. Option B, religious freedom. Option C, bioethics. Option D, ethics. The correct answer is Option C, bioethics. Explanation. Bioethics applies ethical principles to questions created by medicine, biology, healthcare technology, research, and advances in treatment. Question 3. Which of the following is an example of negative kind 6? Option A, smiling. Option B, eye contact. Option C, frowning. Option D, good grooming. The correct answer is Option C, frowning. Explanation. Kind 6 refers to body movement and nonverbal expression. Frowning communicates a negative nonverbal message. Question 4. The term refers to the list of charges for each of the provider's services. Option A, fee schedule. Option B, coinsurance. Option C, copayment. Option D, cost sheet. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 5. A female patient came into the emergency room with her husband. She was suffering from severe shortness of breath. She appeared to be unable to take in sufficient oxygen. What is the color of the skin and nail beds? Option A, brownish. Option B, greenish. Option C, reddish. Option D, bluish. The correct answer is Option D, bluish. Explanation. Bluish discoloration of the skin or nail beds can indicate cyanosis, which occurs when the blood contains an increased amount of deoxygenated hemoglobin. Question 6. Defamation through spoken statements is known as Option A, libel. Option B, sympathy. Option C, empathy. Option D, slander. The correct answer is Option D, slander. Explanation. Slander is defamation communicated through spoken words, while libel generally refers to defamation in written or recorded form. Question 7. A monitor that a patient wears for 24 hours is called an Option A, Holter. Option B, 12 lead. Option C, Holter. Option D, echocardiogram. The correct answer is Option C, Holter. Explanation. A Holter monitor records the heart's electrical activity continuously during normal daily activities, commonly for about 24 hours or longer. Question 8. There are two types of civil actions healthcare providers for injuries resulting from healthcare. The first one is lack of informed consent and the second one is Option A, violation of standard of care. Option B, trial and post-trial. Option C, violation of confidentiality. Option D, violation of continued care plan. The correct answer is Option A, violation of standard of care. Explanation. A violation of the standard of care occurs when a healthcare provider fails to act with the level of skill and care expected under similar circumstances. Question 9. A 67-year-old man is diagnosed with atrial fibrillation and is treated with warfarin Coumadin. What is the characteristic of atrial fibrillation? Option A, sawtooth-shaped waves. Option B, P waves are absent. Option C, P waves with uniform shape. Option D, P waves of multiple shapes. The correct answer is Option B, P waves are absent. Explanation. In atrial fibrillation, organized P waves are absent because atrial electrical activity is rapid and chaotic rather than produced by regular sinus node impulses. Question 10. Which of the following is the best specimen to test for levels of iron in the blood? Option A, the one collected in a tube that contains sodium citrate. Option B, the one collected in a microcuvette. Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Option D, the one collected in a tube with no additive. The correct answer is Option C, the one collected in the tube that contains ethylenediamine tetrashic acid. Explanation. The source keys the tube containing ethylenediamine tetrashic acid. Because iron testing methods can depend on the laboratory protocol, this item should be checked against the specific course or laboratory standard being used. Question 11. During assessment, the best source from which to obtain patient information is the Option A, the medical record. Option B, physician's notes. Option C, a family member. Option D, the physician. The correct answer is Option A, the medical record. Explanation. The medical record is the organized source of documented patient information, including history, medications, allergies, prior findings, and treatment information. Question 12. Most specialists are paid by managed care organizations using which of the following methods? Option A, fee-for-service. Option B, coinsurance. Option C, copayment. Option D, capitation. The correct answer is option A, fee-for-service. Explanation. Fee-for-service reimburses the specialist for individual services performed rather than paying a fixed amount per enrolled patient. Question 13. Which limb sensor is the reference or ground electrode? Option A, right arm. Option B, left arm. Option C, left leg. Option D, right leg. The correct answer is option D, right leg. Explanation. The right leg sensor serves as the reference or ground electrode in the standard electrocardiogram limb electrode arrangement. Question 14. Health policies that concern a patient's constitutional right to privacy, informed consent and confidentiality are part of Option A, medical statutes. Option B, Patient's Bill of Rights. Option C, consent laws. Option D, disclosure laws. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 15. Without a clot activator, whole blood typically clots in minutes. Option A, 60 to 20. Option B, 1 to 2. Option C, 30 to 60. Option D, 5 to 10. The correct answer is option C, 30 to 60. Explanation. Without a clot activator, blood in a plain collection tube may require about 30 to 60 minutes to clot completely before centrifugation. Question 16. All pathogens are Option A, microorganisms that live in soil. Option B, microbes that can cause disease. Option C, communicable microorganisms. Option D, normal bacteria found on skin. The correct answer is option B, microbes that can cause disease. Explanation. A pathogen is a microorganism or other infectious agent capable of causing disease in a host. Question 17. Which of the following cannot be handled by the medical assistant? Option A, patient requesting emergency medical advice. Option B, new patient and return appointments. Option C, directions to the facility. Option D, whether or not a physician is in a certain health plan. The correct answer is option A, patient requesting emergency medical advice. Explanation. A request for emergency medical advice requires clinical assessment and decision-making beyond routine administrative handling by a medical assistant and should be escalated according to office protocol. Question 18. When a blood pressure cuff is deflated, the first tapping sound is the pressure. Option A, pulse. Option B, systolic. Option C, mean arterial. Option D, diastolic. The correct answer is option B, systolic. Explanation. The first Korokov sound heard while the cuff pressure falls marks the systolic pressure, which reflects arterial pressure during ventricular contraction. Question 19. A patient has a possible corneal abrasion and needs a referral. Which specialty is a physician that deals with eye injury and disease? Option A, ophthalmologist. Option B, oncologist. Option C, optician. Option D, optometrist. The correct answer is option A, ophthalmologist. Explanation. An ophthalmologist is a physician who diagnoses and treats eye diseases and injuries and can provide medical and surgical eye care. Question 20. Which of the following procedures can be performed by a medical assistant? Option A, intramuscular injection. Option B, start fluids through a catheter. Option C, insert peripheral catheter. Option D, intravenous injection. The correct answer is option A, intramuscular injection. Explanation. Intramuscular injections are within the usual delegated clinical duties of a properly trained medical assistant when permitted by state law and office policy, while intravenous procedures may require different authorization. Question 21. What is the minimum number of electrodes that may be attached to the patient for Holter monitoring? Option A, 12 electrodes. Option B, 2 electrodes. Option C, 5 electrodes. Option D, 10 electrodes. The correct answer is option C, 5 electrodes. Explanation. The source specifies 5 electrodes as the minimum for this Holter monitoring setup. The exact lead configuration can vary by device, so equipment instructions should be followed. Question 22. A routine hand wash procedure uses plain soap to remove soil and transient bacteria. Option A, scrub brushes. Option B, antimicrobial soap. Option C, gel-based creams after the routine hand wash. Option D, medicated towels for drying clean hands. The correct answer is option B, antimicrobial soap. Explanation. The source keys antimicrobial soap, but the stem states that routine handwashing uses plain soap. This item is internally inconsistent and should be reviewed against the original course material before use. Question 23. What drug enhances the effects of another drug? Option A, narcotic. Option B, antagonist. Option C, trade. Option D, synergistic. The correct answer is option D, synergistic. Explanation. A synergistic drug interaction occurs when one drug increases or enhances the effect of another drug. Question 24. Which of the following is considered a parasitic infection? Option A, Lyme disease. Option B, rabies. Option C, ringworm. Option D, malaria. The correct answer is option D, malaria. Explanation. Malaria is caused by Plasmodium parasites that are transmitted through the bite of infected mosquitoes, so it is a parasitic infection rather than a bacterial, viral, or fungal disease. Question 25. Which of the following specimens are best utilized to measure clotting factors? Option A, serum. Option B, whole blood. Option C, plasma. Option D, sterile blood. The correct answer is option C, plasma. Explanation. Plasma is used for many clotting factor tests because the specimen retains clotting proteins when blood is collected with the correct anticoagulant. Question 26. The way to organize appointment scheduling so that it best supports the success of the practice is to: Option A, include a lot of time physician's administrative activities. Option B, allow frequent breaks. Option C, consider the preferences of the physician. Option D, schedule as many patients as possible throughout the entire day. The correct answer is option C, consider the preferences of the physician. Explanation. Considering the physician's working preferences helps create a realistic schedule that supports workflow, patient access, and the way the practice is actually run. Question 27. The principal advantage of using wave method when designing the scheduling process is that it: Option A, provides more breaks for staff. Option B, allows flexibility to accommodate the unpredictable. Option C, gives priority to established patients. Option D, enables the physician to see more patients each day. The correct answer is option B, allows flexibility to accommodate the unpredictable. Explanation. Wave scheduling builds flexibility into the schedule by grouping several patients near the same time so the office can absorb delays, variable visit lengths, and unexpected events. Question 28. Material safety data sheet information includes: Option A, table of chemical elements. Option B, product manufacturing conditions. Option C, general and emergency information. Option D, information on competitor products. The correct answer is option C, general and emergency information. Explanation. A material safety data sheet provides safety information about a chemical, including hazards, safe handling, first aid, and emergency response information. Question 29. The layer of the heart that is responsible for contraction and relaxation is known as the: Option A, pericardium. Option B, myocardium. Option C, endocardium. Option D, epicardium. The correct answer is option B, myocardium. Explanation. The myocardium is the thick muscular middle layer of the heart wall and generates the force needed for cardiac contraction. Question 30. Which of the following vacutainer tubes is routinely used for hematology testing? Option A, light blue top tubes. Option B, red top tubes. Option C, lavender top tubes. Option D, green top tubes. The correct answer is option C, lavender top tubes. Explanation. Lavender top tubes contain ethylenediamine tetrashic acid, which preserves blood cell morphology and is widely used for hematology tests such as a complete blood count. Question 31. How far above the site of draw is the tourniquet placed? Option A, 3-4 inches. Option B, 1-2 inches. Option C, 5-7 inches. Option D, 4-6 inches. The correct answer is option A, 3-4 inches. Explanation. Placing the tourniquet about 3 to 4 inches above the intended puncture site helps make the vein more prominent without obstructing access to the site. Question 32. The boundaries for the approved area in performing heel punctures are: Option A, the line extending from the third toe, dividing the plantar surface into medial and lateral aspects. Option B, the line extending from the third and fourth toe, dividing the plantar surface. Option C, the lateral line extending from the third toe and the medial line extending from the second toe. Option D, the medial line extending from the great toe and lateral line extending from the fourth and fifth digit. The correct answer is option D, The medial line extending from the great toe and lateral line extending from the fourth and fifth digit. Explanation. Heel punctures are limited to the approved medial and lateral plantar areas to reduce the chance of injuring the heel bone, nerves, and vessels. Question 33. Information given by a patient to medical personnel that cannot be disclosed without consent constitutes: Option A, duty of care. Option B, negligence. Option C, judgment. Option D, privileged communication. The correct answer is option D, privileged communication. Explanation. Privileged communication is confidential information shared within a protected professional relationship and is not normally disclosed without authorization or another lawful basis. Question 34. One example of a physiologic response to negative stress is: Option A, headache. Option B, high energy. Option C, sleep deprivation. Option D, upset stomach. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 35. When using a ventrogluteal approach to give an intramuscular injection in the buttock area, what is the muscle the medication goes in? Option A, gluteus maximus. Option B, gluteus medius. Option C, right upper and outer quadrant. Option D, gluteus minimus. The correct answer is option B, gluteus medius. Explanation. The ventrogluteal intramuscular site overlays the gluteus medius and is selected because it provides a thick muscle mass away from major nerves and blood vessels. Question 36. Protected health information stands for: Option A, protected health information. Option B, private health instructions. Option C, private health information. Option D, protected health instructions. The correct answer is option A, protected health information. Explanation. Protected health information is individually identifiable health information that is protected by privacy rules when handled by covered healthcare organizations and their business associates. Question 37. Mr. Matthews called the office to get the test results for his wife, Martha. What should the medical assistant do? Option A, tell Mr. Matthews that you cannot release the information. Option B, check the medical record to see if Mr. Matthews is really Martha's husband, if so then release the information. Option C, tell Mr. Matthews the test results. Option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. The correct answer is option D, check the medical record to see if Mr. Matthews is authorized to have this information on Mrs. Matthews' Health Insurance Portability and Accountability Act form. If so, then release the information. Explanation. Test results may be released to a spouse only when the patient has authorized that disclosure or another valid legal basis exists, so the medical record must be checked before information is shared. Question 38. A patient has an oral temperature of 100.8 degrees Fahrenheit. The medical term for this is: Option A, pyrexia. Option B, pyuria. Option C, hyperpyrexia. Option D, purulent. The correct answer is option A, pyrexia. Explanation. Pyrexia means fever, so an oral temperature above the normal range may be described as pyrexia. Question 39. Important information a patient should know about immunizations would be that: Option A, they are not necessary if quality infection is maintained. Option B, they are prophylactics against deadly diseases. Option C, they are known to cause autism. Option D, they can unintentionally give the recipient a disease. The correct answer is option B, they are prophylactics against deadly diseases. Explanation. Immunizations are preventive measures that prepare the immune system to respond to specific infectious diseases before exposure causes serious illness. Question 40. Which of the following should be used to chill a specimen as it transported? Option A, a small freezer unit. Option B, frozen blocks of ice. Option C, crushed ice. Option D, tepid water. The correct answer is option C, crushed ice. Explanation. Crushed ice surrounds the specimen closely and provides efficient chilling when a test requires transport at a low temperature. Question 41. Narrowing of the valve between the left atrium and the left ventricle is called: Option A, mitral stenosis. Option B, aortic stenosis. Option C, pulmonary stenosis. Option D, tricuspid stenosis. The correct answer is option A, mitral stenosis. Explanation. Mitral stenosis is narrowing of the mitral valve, which lies between the left atrium and left ventricle. Question 42. Which of the following is the most common means of transmitting pathogens? Option A, ingesting food. Option B, blood transfusions. Option C, coughing. Option D, touching. The correct answer is option D, touching. Explanation. Hands and touch are common ways pathogens move between people and surfaces, which is why hand hygiene is one of the most important infection prevention measures. Question 43. A baby's pulse and respirations are: Option A, the same as adults. Option B, not significantly different than an adult. Option C, faster than an adult's. Option D, slower than an adult's. The correct answer is option C, faster than an adult's. Explanation. Infants normally have faster heart rates and respiratory rates than adults because of their smaller body size and higher metabolic demand. Question 44. Is usually sponsored and partially paid by an employer. Option A, TRICARE. Option B, private insurance. Option C, workers' aid. Option D, group health insurance. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 45. Which of the following types of filing systems requires a cross-reference files? Option A, alphabetic. Option B, subject. Option C, geographic. Option D, numeric. The correct answer is option D, numeric. Explanation. Numeric filing systems require an alphabetical cross-reference or index so staff can locate the patient's assigned number from the patient's name. Question 46. The amount that an insurance company may say is not allowed and not the responsibility of the patient, for a contracted physician, would be identified as this on the patient's account. Option A, a payment. Option B, an adjustment. Option C, a charge. Option D, a deductible. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 47. The medical assistant is to collect a prothrombin time test, a complete blood count, and a fasting blood sugar. What is the correct order of draw? Option A, gray fasting blood sugar, lavender prothrombin time, red complete blood count. Option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Option C, lavender fasting blood sugar, red complete blood count, green prothrombin time. Option D, gray fasting blood sugar, lavender complete blood count, light blue prothrombin time. The correct answer is option B, light blue prothrombin time, lavender complete blood count, gray fasting blood sugar. Explanation. The keyed order places the light blue coagulation tube before the lavender hematology tube and the gray glucose tube, which follows the source's order of draw sequence for these specimens. Question 48. How do you know when you have achieved adequate ventilation for a patient when doing cardiopulmonary resuscitation? Option A, air escapes the nose. Option B, air enters the stomach. Option C, rise of the chest. Option D, you hear a popping sound. The correct answer is option C, rise of the chest. Explanation. Visible chest rise shows that enough air is entering the lungs to expand the chest during rescue ventilation. Question 49. Family members, such as spouse or children that are covered under the member's insurance policy are known as: Option A, members. Option B, beneficiaries. Option C, dependents. Option D, subscribers. The correct answer is option C, dependents. Explanation. Dependents are eligible family members, such as a spouse or children, who receive coverage under the insured person's health plan according to the plan's rules. Question 50. The invoice for the monthly rent of the building where the medical office is located is typically handled by which department? Option A, compliance. Option B, human resources. Option C, accounts payable. Option D, accounts receivable. The correct answer is option C, accounts payable. Explanation. Accounts payable handles money the medical office owes to others, such as rent, utilities, and vendor invoices. Question 51. Which of the following are also referred to as serum separator tubes? Serum separator tube. Option A, red and gray top tubes. Option B, red top tubes. Option C, light blue top tubes. Option D, lavender top tubes. The correct answer is option A, red and gray top tubes. Explanation. Red and gray marbled tubes are serum separator tubes because they contain a gel barrier that separates serum from blood cells after centrifugation. Question 52. Tachycardia is a pathology that damages mainly the: Option A, heart muscle. Option B, brain. Option C, blood vessels. Option D, body organs. The correct answer is option A, heart muscle. Explanation. The source keys heart muscle Tachycardia means an abnormally fast heart rate and can increase cardiac workload, but the wording that it directly damages one organ should be reviewed for accuracy. Question 53. The medical assistant was sent to the ward to draw blood for coagulation studies. Which of the following is correct about this draw? Option A. The medical assistant can use capillary tubes for the blood collection. Option B. Draw a red top tube before the light blue tube. Option C. Fill a light blue to the top. Option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. The correct answer is option D. Before drawing the specimen, make sure the patient has fasted for 12 hours. Explanation. The source keys a 12-hour fast before coagulation studies, but fasting is not generally the defining requirement for routine coagulation collection. This item should be verified against the course source before use. Question 54. The mental and emotional condition, enthusiasm, loyalty, or confidence of an individual or group with regard to function or tasks at hand is called. Option A. Morale. Option B. Insubordination. Option C. Initiative. Option D. Tenacity. The correct answer is option A. Morale. Explanation. Morale describes the confidence, enthusiasm, and emotional outlook of an individual or group toward its work and responsibilities. Question 55. A female patient came into the emergency room due to vaginal bleeding. What is the name of the instrument used to hold open the wall of the vagina? Option A. Retractor. Option B. Speculum. Option C. Hemostat. Option D. Forceps. The correct answer is option B. Speculum. Explanation. A speculum is used to separate and hold open the vaginal walls so the cervix and vaginal canal can be examined. Question 56. A 67-year-old man comes into the doctor's office for a regular checkup. The doctor orders an electrocardiography to be done on the patient. There is junctional escape beat noticed by you. What is the origin of this rhythm? Option A. Atrioventricular node. Option B. Bundle branches. Option C. Ventricle. Option D. Sinus node. The correct answer is option A. Atrioventricular node. Explanation. A junctional escape beat originates in tissue near the atrioventricular junction when the normal pacemaker fails to fire or its impulse does not reach the ventricles. Question 57. The hormone tested for in pregnancy tests is: Option A. Thyroid-stimulating hormone. Option B. Progesterone. Option C. Estrogen. Option D. Human chorionic gonadotropin. The correct answer is option D. Human chorionic gonadotropin. Explanation. Pregnancy tests detect human chorionic gonadotropin, a hormone produced after implantation and released in increasing amounts early in pregnancy. Question 58. Regulation of the heart rate, speed of electrical conduction and strength of contraction are influenced by the brain via the nervous system. Option A. Autonomic. Option B. Somatic. Option C. Core. Option D. Voluntary. The correct answer is option A. Autonomic. Explanation. The autonomic nervous system regulates involuntary cardiac functions such as heart rate, conduction speed, and force of contraction through sympathetic and parasympathetic influences. Question 59. A female patient came into the office for her scheduled routine physical. You are measuring the patient's vital signs. Which part of the brain is responsible for the temperature regulation? Option A. Hypothalamus. Option B. Thalamus. Option C. Medulla oblongata. Option D. Pons. The correct answer is option A. Hypothalamus. Explanation. The hypothalamus helps regulate body temperature by comparing internal temperature signals with the body's set point and triggering heat loss or heat conservation responses. Question 60. Which of the following precautions require special air handling and ventilation? Option A. Contact precautions. Option B. Standard precautions. Option C. Airborne precautions. Option D. Droplet precautions. The correct answer is option C. Airborne precautions. Explanation. Airborne precautions require special ventilation because very small infectious particles can remain suspended in the air and travel beyond the immediate patient area. Question 61. Managed care organizations control costs by: Option A. Limiting patient enrollment. Option B. Detecting risk factors early. Option C. Discouraging patient visits. Option D. Eliminating case managers. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 62. Which of the following procedures is appropriate for preparing blood and other potentially infectious materials for transport? Option A. Freezing the materials before transport. Option B, placing the materials in a leak-proof container during collection. Option C, decontaminating the hazardous waste container. Option D, relabelling containers provided for waste. The correct answer is option B, placing the materials in a leak-proof container during collection. Explanation. Potentially infectious specimens must be placed in leak-resistant containers so blood or body fluid cannot escape during handling and transport. Question 63. Sinus is a slow dysrhythmia. Option A, bradycardia. Option B, tachycardia. Option C, rhythm. Option D, dysrhythmia. The correct answer is option A, bradycardia. Explanation. Sinus bradycardia is a sinus rhythm with a slower than expected rate because the sinoatrial node is firing slowly. Question 64. Your patient is experiencing chest pain and has a heart rate of 132 beats per minute. You attach the electrocardiogram monitor and see a fast, regular rhythm with a round upright P wave that precedes each QRS complex. The QRS complexes are 0.1 seconds in duration. This patient is experiencing option A, junctional escape rhythm. Option B, sinus tachycardia. Option C, complete atrioventricular heart block. Option D, idioventricular rhythm. The correct answer is option B, sinus tachycardia. Explanation. A fast regular rhythm with a normal upright P wave before every narrow Q or S complex is characteristic of sinus tachycardia because the rhythm is still originating from the sinus node. Question 65. Veterans with service-related disabilities are eligible for care under which of the following programs? Option A, TRICARE. Option B, VetServe. Option C, Civilian Health and Medical Program of the Department of Veterans Affairs. Option D, CHAMP Aid. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 66. The insurance carrier is allowed to use any method to determine the amount for a service, also known as the Option A, fee schedule. Option B, deductible. Option C, allowed amount. Option D, insurance premium. The correct answer is now shown. Explanation. The source flashcard does not provide a keyed answer for this item. The answer and rationale should be confirmed from the original course material before the question is used. Question 67. Muscles that act on the knee joint exhibit two actions. Option A, adduction and lateral rotation. Option B, medial rotation and extension. Option C, adduction and abduction. Option D, flexion and extension. The correct answer is option D, flexion and extension. Explanation. The knee primarily moves through flexion and extension, which bend and straighten the joint. Question 68. After a patient interview by the medical assistant, which of the following should not be recorded by the medical assistant? Option A, family medical history. Option B, examination narrative. Option C, chief complaint. Option D, medication allergies. The correct answer is option B, examination narrative. Explanation. The medical assistant may document information obtained during the interview, but the provider's examination narrative belongs to the provider's clinical examination and should not be independently created by the assistant. Question 69. Somatic tremor is the result of Option A, muscle movement. Option B, loose sensors. Option C, unequal amounts of electrolytes. Option D, improper standardization of the instrument. The correct answer is option A, muscle movement. Explanation. Somatic tremor is an electrocardiogram artifact caused by skeletal muscle movement, such as shivering, tension, or patient motion during the recording. Question 70. Az's toll. Option A, is defined as the presence of chaotic cardiac activity. Option B, produces a complete cessation of cardiac output. Option C, is the most common primary event in cardiac arrest in the adult. Option D, appears as a chaotic line on the electrocardiogram monitor. The correct answer is option B, produces a complete cessation of cardiac output. Explanation. Az's toll means the absence of effective ventricular electrical activity and therefore no effective cardiac output. Question 71. Every prescription for a controlled substance requires the physician's signature and a number? Option A, Food and Drug Administration. Option B, Drug Enforcement Administration. Option C, Environmental Protection Agency. Option D, Centers for Disease Control and Prevention. The correct answer is option B, Drug Enforcement Administration. Explanation. Controlled substance prescriptions require the prescriber's Drug Enforcement Administration registration number because that agency regulates controlled substances in the United States. Question 72. What is the best sample for the determination of blood pH and blood gases? Option A, cerebrospinal fluid. Option B, arterial blood. Option C, venous blood. Option D, capillary blood. The correct answer is option B, arterial blood. Explanation: arterial blood is preferred for blood gas testing because it best reflects oxygenation, ventilation, and acid-base status after gas exchange in the lungs. Question 73. Which of the following is an example of a biohazard? Option A, spilling a chemical on a countertop. Option B, splashing of blood when a cap is removed. Option C, touching electrical equipment with wet hands. Option D, the potential for a fire to start. The correct answer is option B, splashing of blood when a cap is removed. Explanation: blood is potentially infectious biological material, so a splash of blood is a biohazard exposure rather than a chemical, electrical, or fire hazard. Question 74. Before developing a medication schedule, you should evaluate the patient's option A, bathroom habits. Option B, medical record. Option C, daily routine. Option D, side effects. The correct answer is option C, daily routine. Explanation: a medication schedule is more likely to be followed when it fits the patient's normal daily routine, such as waking, meals, work, and bedtime. Question 75. Sodium citrate is the additive in what color tube? Option A, red. Option B, green. Option C, light blue. Option D, lavender. The correct answer is option C, light blue. Explanation: light blue tubes contain sodium citrate, an anticoagulant used primarily for coagulation testing because it binds calcium in a controlled ratio. Question 76. Which choice is a typical educational for elderly patients to prevent disease? Option A, the location of the patient's public health resources in their community. Option B, health anti-aging skin care techniques and products. Option C, sterile technique used in the medical practice. Option D, annual flu pneumonia vaccination information. The correct answer is option D, annual flu pneumonia vaccination information. Explanation: vaccination education is an important preventive topic for older adults because immunization can reduce the risk of serious respiratory infections and related complications. Question 77. A provider withdraws from the care of a patient without reasonable notice of discharge is considered. Option A, abandonment. Option B, malpractice. Option C, negligence. Option D, slander. The correct answer is option A, abandonment. Explanation: abandonment occurs when a provider ends the professional relationship without reasonable notice or without giving the patient a reasonable opportunity to obtain continued care. Question 78. A female patient came into the clinic for follow-up after a right-sided mastectomy with some removal of lymphoid tissue. What is the name of the condition that makes blood draw on the right arm not recommended? Option A, syncope. Option B, lymphostasis. Option C, anemia. Option D, hemoconcentration. The correct answer is option B, lymphostasis. Explanation: lymphostasis means impaired lymph drainage and can occur after lymph node removal, which is why venipuncture is often avoided on the affected side when possible. Question 79. The patient information sheet contains option A, the past medical history of the patient. Option B, the patient's past family history. Option C, the patient's chief complaint. Option D, patient's personal and insurance information. The correct answer is option D, patient's personal and insurance information. Explanation: the patient information sheet is used to collect identifying, contact, and insurance information needed for registration, billing, and communication. Question 80. A patient is having a seizure. Which of the following is the most appropriate step for the medical assistant to take to protect the patient? Option A, raise the patient's feet. Option B, call for help. Option C, loosen clothing around the patient's neck. Option D, administer small amounts of liquid. The correct answer is option C, loosen clothing around the patient's neck. Explanation: loosening tight clothing around the neck can help protect breathing during a seizure. The patient should also be protected from injury and nothing should be placed in the mouth. Question 81. An obese patient was sent to the laboratory for a complete blood count. Which of the following veins is MOT likely to be the only that the phlebotomist can palpate? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, sclerosed vein. The correct answer is option B, cephalic vein. Explanation: the cephalic vein lies along the outer side of the arm and may be easier to palpate in some patients when deeper veins are difficult to locate.